Ladies and gentlemen, as I stand here, the last speaker, after so many remarkable contributions, and I feel rather small, I'm reminded of the story of the elephant who met the little mouse in the jungle. And the elephant looked at the little mouse and he said, "Why am I so big and you're so small?" And the little mouse looked up and said, "Well, I had flu lately." Our previous speakers, my professional colleagues, fellow DTN alumni, have all told remarkably engaging stories of different paths that their nursing profession has taken them on, paths that always lead to the same objective. And I think that's been made very clear by all of them. Helping people to help themselves get better, to help them make the best of themselves. And that's why I became a nurse. In fact, I had the temerity to respond to the requirement of writing a 500-word essay in my first year of nursing school by writing 20 words. I simply wrote, "I want to be a nurse to help people help themselves get better and to make the best of themselves." The cheek of it, but lucky for me, the teacher thought like I did and gave me an A+. So I was on my way. I've often looked back and wondered if that was when I first unwittingly took my first step beyond normal, comfortable boundaries. I really believe in stepping out of your comfort zone. It's scary, it's exciting, and challenging, but more importantly, it enriches you and it enriches the people you take with you on your journey beyond your wildest dreams. Coming here to LSHTM in, I hate to say 1998, was stepping out of normal boundaries for me. I felt extremely privileged to be here as a student. And I'd like to thank the visionaries who put this DTN on the map. Visionaries like Dame Claire Birchsinger, John Williams, who we've had today, who have all led and developed the DTN into the world-renowned course it is today. Over the last 20 years, the DTN has empowered thousands to go where they are needed most and where they change lives for the better. To be taught by professors who carry out their work with passion, excellence, and conviction was pure joy and highly contagious and incurable for me. I just wanted more and more and more. There are so many fascinating tropical diseases, but my imagination was caught by somebody who I just saw sneak into the leprosy hall, Professor Diana Lockwood. She lectured my class on leprosy. She informed us that leprosy is curable, that the early diagnosis and treatment will prevent disabilities and deformities. She said the drugs were free and available worldwide. She told us that the World Health Organization had a global alliance to eliminate leprosy by the year 2000. And Nepal, my favorite country and one that I have visited regularly since 1976, was at that time in the top 5 highest endemic countries in the world. I was intrigued, incensed, and mystified to learn that in this day and age of modern medicine, why did people of all ages continue to suffer the dire consequences of a curable disease? This is really unnecessary and unacceptable, I said to myself. All the tools were available. We just had to implement them somehow on the ground. So I decided when I graduated, I would go to Nepal. The possibility of playing a role in eliminating the age-old disease of leprosy and preventing further suffering greatly appealed to me. I like result-oriented medicine, as I'm sure most of you in this room do too. I had a network of friends in Nepal who introduced me to those working in leprosy, and they were working on a shoestring. We've heard lack of resources, lack of policy, lack of money. Leprosy is not a popular disease, and many of the medical people, Nepali people, were actually also stigmatized for working with leprosy-affected people. In the first 5 days I was there, 12,000 new cases of leprosy were detected in what's called a leprosy elimination campaign, literally knocking on doors looking for new patients. Obviously, the need was great. It was hugely overwhelming to me. No idea. And I said to the people, I said, look, I promise I'll help you somehow. I don't know exactly how I'll help you, but I will help you. I had no idea what I was doing. I had no idea the commitment I was making or the exciting, challenging, complex journey that lay ahead of me. I returned to the UK and I quickly realized that I needed to raise the profile of a disease that most people had felt was long forgotten, that didn't exist anymore. And obviously you need to raise funds to do anything in a third world country. Once again, I was lucky. I've had a lot of luck in my life. Professional friends set up a UK registered charity for me and we called it Promise Nepal. There were many moments of doubt. Can I do this? Am I doing the right thing? And once again, luck played a big role, as did my network of friends, professional colleagues, mentors, and people who I admire and respect, who I have always taken the time to learn from and listen to. They encourage you and they inspire you and help you pick yourself back up again and get out in the field. I returned to Nepal with funds in hand. We have had a lucky fundraising. And it's always a pleasure for me to go to Nepal. It's a country where I have met and become friends with some of the poorest, most generous, most hospitable people in the world. And they are a very, very proud race. And there I received one of the most unusual invitations I have ever had in my life. It came from the chairman of Bungamati Village Development Committee. And he asked me to attend the opening ceremony of his defecation-free zone. Nepali people are full of surprises. But I dream one day of having the legitimacy to set up a banner that invites people to a leprosy-free zone. I really do dream of that. Many unexpected and serious challenges confronted and confounded me, and it served me right. I'd been very naive to think that we just had to find the patients and get them started on the free drugs. Not so. Here I am, trying to explain the drug regime to a leprosy patient. Pasang looked at me in disbelief and he said, "Are you stupid, Maggie?" I can speak Nepali fairly well. He said, "Your pills won't do anything for me. I'm cursed by the gods. I'm a bad person. I did lots of bad things in my past life." And he just tossed them on the floor and said, "They're rubbish, do nothing for me." After such a direct message, I realized that Pasang was right and how stupid I had been to think that I could arrive with my Western medicine and expect thousands of years of cultural beliefs and traditions to disappear in a package of pills. I needed help. I knew that, and I needed more professional knowledge. I remembered that Claire had encouraged her DTN students to do a master's degree in public health, medical anthropology, international development. Unlike the people who sat at the back row, I think I sat pretty well near the front, but I didn't really pay any attention. Well, no, but there's a good reason why. I didn't have an undergraduate degree. I went to nursing school in Canada, so I obviously wasn't going to university to get a master's degree, so I didn't pay any attention. But I had a problem, and I had a vision, and I wanted to help these people. So I rang Claire, and she kindly gave me her time, her guidance, and encouragement. And she said I didn't need a degree. I said, "What do you mean I don't need a degree?" And she said that your life's work so far will qualify you to get into university. Just apply. So I did, and I got in. Wow. And it was so fantastic to study something and research something that you're so interested in, but also something that you had already had a bit of experience on the ground. I used to argue hugely with my professors, and I was older than several of them too, so that was okay. But a master's degree in medical anthropology acknowledges the truly universal concern for the sick and increases your sensitivity to the human environment that you have to work in, but the one that your patients have to live in. It also gave me an analytical perspective that I did not have before that. And it was humbling to live amongst the destitute sick. The leprosy affected people who had been geographically imprisoned from the outside world and further imprisoned in their own bodies by the ravages of unchecked leprosy, which disabled and deformed them. I immersed myself in their world to do ethnographic research for 3 months. This gave me a unique insight into how they formed their cultural and social norms inside a leprosy colony, how they defined their own illness experience. And most importantly, it gave me the opportunity to gain their trust. I was appalled at how they'd been neglected, abandoned, left behind, when their health care needs were so great. I wrote my dissertation and graduated. My experience of living at the leprosy colony showed me that the World Health Organization's policies were ineffective on the ground. Leprosy-affected people were neglected and suffering terribly and needlessly. This was wrong. It infuriated me. And once again, I took one step beyond. But this was a big step, one step beyond. Having a master's degree and the experience of living in the leprosy colony somehow gave me the courage to take myself to Geneva and challenge the leprosy experts at the WHO. It did. I went. To my utter astonishment and disappointment, they met with me, 5 doctors met with me. They were more interested in getting positive statistics for themselves, and statistics that I would say were rather dubious, than they were in meeting the patient's needs. I told them I had wasted my time coming to the World Health Organization. I left the meeting in despair and disbelief. And as I walked down if you've ever been to WHO Geneva, the extremely long, lonely corridor by myself, and I heard footsteps following me. Oh my God, it's one of those doctors, So I just kept going, and there's a tap on my shoulder. So I looked around, and it was one of those doctors, and he apologized to me. And he said, Maggie, he said, will you promise me that you will look after those patients in that leprosy colony? I thought to myself, I'm one tiny little person, tiny little charity, you're the WHO. And he said, that may be so. He said, but will you promise me? Of course I did. How could I do anything else? Thanks to the DTN, Claire's encouragement, my mentors, lots of luck, lots of networks, my master's degree, I had pursued my passion, and now I had the professional capabilities to do this job. So the Promise Nepal team we put together did continue, and to this day continues to look after the patients in Coconut Leprosy Colony. And I can say that we have definitely changed their lives for the better and helped them to make the best of themselves. And I'd like to give you 2 brief examples of, because I could talk for hours about leprosy, and I have so many stories to tell, but we're on a limited time here. One of the things Promise Nepal has done is provided training for a Nepali orthopedic surgeon to become a plastic reconstructive surgeon, as other people have mentioned. You've got to empower the indigenous people, and they are smart, and they are talented. They just need a chance. And he performs miracles. Here is one. Right here, he reconstructed what was left of this woman's hands, and we taught her to knit. So today she's got a sense of purpose. She's got a sense of contributing to life. She sells her knitting, and she has regained her dignity, and I have one very precious gift here. Just one of many stories. This mother and daughter I met on my first day in the leprosy colony, Sumitra and her mother Sani Nani. It was so obvious to see what a beautiful woman her mother, Sani Nani, would have been had she not been incarcerated. Incarcerated! It was a criminal offense to have leprosy at the time. She was 8 years old in the leprosy colony and subjected to years of harmful, ineffective treatments. I wanted to make sure that her daughter never, ever got leprosy. So we raised funds to educate her and put her through nursing school. She's now a staff nurse in the largest leprosy hospital in Nepal. She married a man outside of the leprosy colony. This is totally unheard of. The stigma is so great against this disease. And now they have 2 gorgeous kids who attend proper schools. They've built their own home in Kathmandu Valley, and they have moved her parents out of the colony. They no longer live in abject poverty, one of the main contributors to the continued existence and transmission of leprosy. And there they are. That's the happy family. I think I can legitimately say that with a little help from Promise Nepal team, that they have really helped these people help themselves get better, and they have put every effort to make the best of themselves. So the Diploma in Tropical Nursing gave me knowledge, inspiration. It opened up many unexpected doors, and it helped me turn my nursing experience into Well, I hope leadership skills and my master's gave me the confidence to continue to pursue my goals, to make people's lives better for them. And I'm sure that there is a passion waiting to turn into action in each and every one of you. Just recognize it and go for it. Thank you very much.